Hi, my name is Sergio Armas. I'm a medical student from Group First E. Today I'm going talking about the topographic anatomy of mammary gland. Okay, so let's get started. Contents of this template. First, topographic anatomy of the mammary gland is relationship to the fascia and pectoral muscles, blood supply and the innervation of the mammary gland. Second, lymphatic system of the mammary gland, lymph drainage, pathways, regional lymph nodes. Okay, first, introduction to the topographic anatomy of the mammary gland. General description of the location and structure of the mammary gland. The mammary gland is an organ belonging to the female reproductive system, found in both sexes but more developed in females. It is located in the chest, just above the pectoral muscles, and is composed primarily of a glandular tissue and adipose tissue. Okay, the mammary gland is composed of multiple lobes, which in turn are made up of numerous glandular acini. These acini are the sites where breast milk is produced and stored during lactation. Each mammary gland is connected to the skin through the mammary ducts, which transport milk to the nipple. Okay, where it can be released during breastfeeding. The structure and size of the mammary gland can vary significantly depending on age, hormonal status, and other individual factors. Relationship with the superficial fascia and pectoral muscles. The mammary gland is surrounded by a layer of connective tissue known as the superficial fascia, which separates it from the subcutaneous adipose tissue and the surrounding skin. Beneath the superficial fascia are the pectoral muscles, which are the primary muscles of the chest. These muscles provide structural support to the mammary gland and contribute to the shape and position of the breast. The relationship between the mammary gland, superficial fascia, and pectoral muscles is important for the function and aesthetics of the breast. Changes in the structure or composition of any of these elements can affect the appearance and health of the breast. Structure of the mammary gland, lobules, ducts, and adipose tissue. Composition of lobules, lactiferous ducts, and mammary adipose tissue. First, lobules. The lobules are the functional units of the mammary gland responsible for producing milk. Each lobule contains clusters of milk-producing cells called alveoli, as well as myoepithelial cells that help contract and expel milk into the ducts. The alveoli are surrounded by supportive connective tissue and lactiferous ducts. These are the ducts that transport milk from the lobules to the nipple. Here you can see the nipple. They are composed of epithelial cells and they are lined with myoepithelial cells, which contract to help push the milk towards the nipple during breastfeeding. Here you can see the lactiferous ducts, the terminal ducts, lactiferous sinus, the areola is all this zone, and the lobe of the mammary glands. Here in the lower part and the upper part also. Okay, you can see here the lactation process. It's reserved in the milk gland, go through the milk duct, and it's exposed through the milk sinus. Okay, next. Functional importance of each component in lactation and mammary anatomy. Mammary adipose tissue in the breast provides structural support and cushioning to the glandular tissue. It also serves as an energy reserve during periods of high metabolic demand, such as pregnancy and lactation. Changes in mammary adipose tissue composition can influence breast size and shape, but do not directly affect milk production or breastfeeding functionality. Okay, overall the coordinated function of lobules, lactiferous ducts, and mammary adipose tissue is essential for successful lactation and maintaining mammary anatomy. Each component contributes uniquely to the process of milk production, transport, and the breast structure. The mammary adipose tissue are composed of adipocytes, blood vessels, nerves, connective tissue, and others. Okay, first, the adipocytes. They are the main cells of adipose tissue and constitute most of the volume of breast adipose tissue. These cells are specialized in storing energy in the form of lipids. In the mammary glands, adipocytes provide structural support and help shape and volume the breast. Blood vessels. Breast adipose tissue is highly vascularized, meaning it contains numerous blood vessels, including arteries, veins, and capillaries. These blood vessels are crucial for supplying oxygen and nutrients to adipose tissue cells, as well as for eliminating waste products from cellular metabolism. Nerves. Breast adipose tissue also contains nerves that provide innervation to the breast. These nerves transmit sensory signals such as tactile and pressure sensations, as well as nerve signals associated with breastfeeding and nipple stimulation during baby sucking. Connective tissue. Breast adipose tissue is grouped in a connective tissue matrix that provides structural support and maintains breast integrity. This connective tissue matrix also plays a role in the uniform distribution of adipocytes and blood vessels within breast adipose tissue. Relationship of the mammary gland with the superficial fascia. Okay, the superficial fascia is a layer of connective tissue located just beneath the skin and above the deeper layers of the muscle and other tissues. It surrounds and envelopes in various structures within the body, including the mammary gland. Okay, here you can see the superficial fascia. In the case of the mammary gland, the superficial fascia forms a supportive sheath around it, providing a layer of protection and structural support. This fascia helps maintain the position and shape of the breast tissue within the chest wall. Okay? Here you can identify some structures near to superficial fascia. First, skin, then superficial fascia, then the muscles. Serratus anterior, external intercostal muscle, internal intercostal muscle, innermost intercostal muscle, also the collateral branches, intercostal nerves, artery and vein. Parietal pleura, visceral pleura, first parietal pleura, then pleural cavity, of course, and then visceral pleura, and finally lungs. Okay, the importance of fascia in the structure and support of the mammary gland. The superficial fascia plays a crucial role in supporting the mammary gland within the breast. It helps to anchor the gland in place and prevents excessive movement or displacement. Additionally, the fascia contributes to the overall structure and integrity of the breast tissue. It helps to distribute forces evenly across the breast, reducing the risk of damage or distortion. The fascia also provides a framework for blood vessels, nerves, and lymphatic vessels that supply and drain the mammary gland, ensuring proper nourishment and waste removal. During events such as pregnancy and lactation, when the mammary gland undergoes significant changes in size and shape, the fascia helps accommodate these changes while maintaining the overall integrity of the breast structure. Now, composition and function of the superficial fascia. The superficial fascia is composed primarily of collagen and elastin fibers, embedded in a matrix of ground substance along with adipose tissue. Collagen provides strength and structural support to the fascia, while elastin allows for flexibility and recoil. Adipose tissue within the superficial fascia serves as a cushioning layer, providing protection against mechanical forces and insulation against temperature changes. The superficial fascia surrounds and supports various structures in the body, including the mammary gland. It forms a supportive shade around the gland, helping to maintain its position and shape within the breast. Additionally, the superficial fascia facilitates movement of the breast tissue over the underlying structures of the chest wall, allowing for changes in breast shape and position during activities such as breastfeeding or physical exertion. The fascia also provides a pathway for blood vessels, lymphatic vessels, and nerves that supply the mammary gland, ensuring proper nourishment, waste removal, and innervation. Relationship with mammary blood supply and the innervation. Blood vessels and nerves that supply the mammary gland travel within the superficial fascia, often alongside or in close proximity to larger structures such as the pectoral muscles. Arteries provide oxygenated blood to the mammary gland, while veins return the oxygenated blood back to the heart. These blood vessels branch and distribute throughout the breast tissue within the superficial fascia. Nerves innervate the mammary gland, providing sensory input and controlling glandular function. They also travel within the superficial fascia, branching out to supply different regions of the breast. The superficial fascia acts as a conduit for these blood vessels and nerves, ensuring proper blood supply and innervation to the mammary gland and facilitating communication between the gland and the rest of the body. In summary, the superficial fascia serves as a supportive and protective layer for the mammary gland, composed of collagen, elastin, and adipose tissue. It facilitates movement, provides structural support, and serves as a conduit for blood vessels and nerves supplying the gland. Okay, here you can identify the nerve supply to the breast. No. Here you can see the lateral cutaneous nerves, the 3rd to the 6th, the intercostal nerves in the 2nd to the 6th also, and supraclavicular branches. Okay, so here you can see the first, lateral number 2, and number 3. Now, relationship between the mammary gland and deep fascia. The deep fascia is a dense layer of connective tissue that lies deeper within the body, beneath the superficial fascia. It surrounds and encapsulates muscles, organs, and other deeper structures, providing structural support and compartmentalization. In the case of the mammary gland, the deep fascia plays a role in providing additional support and anchorage. It helps to maintain the position of the gland within the chest wall and provides a framework for the attachment of surrounding structures. While the primary support for the mammary gland comes from the superficial fascia, the deep fascia adds an extra layer of stability, especially in relation to the deeper muscles and ligaments of the chest wall. Okay, here can identify some structures. For example, here the number 1 are the Cooper's ligament. The breast lobe are ubicated here also. The extralobular duct, number 3, you can see in all these parts. Ductal ampulla is in here, is the reservoir. 5th, the main duct, here, the 5th. The 6th, nipple, we already see. 7, skin. Okay, it's obviously skin here. Subcutaneous fat, more deeper. Mammary layer fatty tissue here. Retromammary fat here, all this on. Lymph nodes, number 11. Here you can see the lymph nodes over to the picture. pectoralis major muscle, here, major, the minor muscle, also pectoralis minor muscle, and the ribs. Okay, let's continue. Connection with the pectoral muscles and Cooper's ligaments. The deep fascia of the chest wall is intimately connected with the pectoral muscles, particularly the pectoralis major and pectoralis minor muscles. These muscles lie beneath the mammary gland and provide additional support and stability to the breast tissue. Cooper's ligaments, also known as the suspensory ligaments of the breast, are fibrous bands of connective tissue that extend from the deep fascia of the chest wall to the overlying skin of the breast. They help to maintain the shape and position of the breast by providing structural support and preventing sagging. The deep fascia serves as the anchoring point for Cooper's ligaments, providing a stable foundation from which these ligaments can suspend and support the mammary gland. Together, the deep fascia pectoral muscles and Cooper's ligaments work synergistically to provide structural support and maintain the position and shape of the mammary gland within the breast. Here you can see an example. If the Cooper ligaments are good, are fine, the form and all of this, and are not break or stretch, the form of the breast are like good in their position. Anatomy and function of the deep fascia of the breast. The deep fascia of the breast, also known as the pectoral fascia or investing fascia, is a dense layer of connective tissue situated deep within the breast tissue. It lies beneath the superficial fascia and extends throughout the breast, forming a continuous sheath around the glandular tissue, blood vessels, and nerves. The deep fascia of the breast is closely associated with the pectoralis major muscle. You know where's pectoralis major, of course. Pectoralis major muscle, which lies deep to the breast tissue. It blends with the deep fascia of the chest wall, contributing to the overall structural and integrity support of the breast. Importance in the distribution of the mammary gland and prevention of breast ptosis. The deep fascia provides crucial support to the mammary gland by acting as a scaffold or framework for the breast tissue. It helps to maintain the shape and position of the breast, preventing excessive sagging or dropping. By entering the mammary gland to the underlying structures of the chest wall, including the pectoralis major muscle and Cooper's ligaments, the deep fascia helps to distribute the weight of the breast evenly. Additionally, the deep fascia contributes to the organization and compartmentalization of the breast tissue, helping to define the boundaries between different regions of the breast and ensuring efficient function. When the deep fascia loses its integrity or is stretched due to factors such as aging, pregnancy, or significant weight changes, it may lead to decreased support for the mammary gland and increased risk of breast ptosis or dropping. Connections between the mammary gland and pectoral muscles. The mammary gland is situated superficially on the chest wall directly above the major and minor pectoral muscles. The major pectoral muscle, also known as the pectoralis major, is the larger and more superficial of the two muscles. It covers much of the chest area and extends from the sternum, breastbone, to the humerus. The minor pectoral muscle, or pectoralis minor, lies beneath the pectoralis major. It originates from the upper ribs and inserts into the coracoid process of the scapula. Here, deeper. Okay, but the major and minor pectoral muscles are connected to the deep fascia of the breast tissue, providing structural support and stability to the mammary gland. Role of pectoral muscles in supporting and moving the mammary gland. The major and minor pectoral muscles Here you can identify this is the major and here are the deeper. Okay, these muscles, particularly during activities such as breathing, arm movement, and breastfeeding, supporting. Okay, these muscles help maintain the position and shape of the breast by providing a stable base of support from beneath. During movements of the arms of upper body, the pectoral muscles contract and relax, contributing to changes in breast position and contour. For example, when the arms are raised or moved forward, the pectoral muscles contract, providing upward support to the breasts. Additionally, the pectoral muscles play a role in breastfeeding. The contraction of these muscles helps compress the breast tissue, aiding in the ejection of milk from the mammary gland during nursing. Overall, the connections between the mammary gland and the major and minor pectoral muscles ensure structural support, stability, and functional movement of the breast tissue within the chest wall. Location and function of the pectoral major muscle. Okay, the pectoralis major muscle is a large, fan-shaped muscle located in the anterior, in the front part of the chest wall. It covers much of the chest area and extends from the sternum, breastbone, to the humerus, upper arm bone. The pectoralis major muscle are divided in two portions. Okay, the clavicular head, which originated from medial half of the clavicle, here, for example, and the sternocostal head, which originated from sternum and the upper six costal cartilages, here, the second example. The fibers of the pectoralis major converge toward their insertion on the humerus, forming a thick, powerful muscle mass that contributes to various movements of the shoulder and arm. The pectoralis major muscle is closely related to the mammary gland as it lies directly beneath the breast tissue. Its fibers extend laterally and inferiorly, providing support and stability to the breast. Importance in the stability and movement of the breast during physical activity. The pectoralis major muscle plays a crucial role in providing stability and support to the breast during physical activity, particularly movements involving the arms and upper body. During activities such as running, jumping, or weightlifting, the pectoralis major muscle contracts to stabilize the chest wall and minimize excessive movement of the breast tissue. This helps prevent discomfort, pain, and potential damage to the delicate structures of the breast. Additionally, the pectoralis major muscle contributes to the movement of the breast during arm movements. For example, when the arms are raised or moved forward, we also see this. Okay, implications of the pectoral minor muscle in mammary anatomy. The pectoralis minor muscle is a smaller, triangular shaped. Here you can see the pectoralis. Okay, is a smaller, triangular shaped muscle located beneath the pectoralis major muscle and major muscle originating from the third to fifth ribs and inserting into the coracoid process of the scapula. Here. While the pectoralis minor muscle is primarily involved in movements of the shoulder and scapula, its position beneath the mammary gland allows it to provide some support to the breast tissue. The contraction of the pectoralis minor muscle helps stabilize the scapula, which in turn can influence the position and movement of the breast during activities involving the arms and upper body. By stabilizing the scapula, the pectoralis minor muscle indirectly contributes to maintaining the position and shape of the breast, particularly during movements that involve raising or rotating arms. Okay, the importance in preventing breast ptosis and exercise-related injuries. While the pectoralis minor muscle provides some support to the mammary gland, its role in preventing breast ptosis is limited compared to the larger and more superficial pectoralis major muscle. However, the stabilization of the scapula by the pectoralis minor muscle can indirectly contribute to maintaining the integrity of the breast tissue and reducing the risk of excessive movement or strain during physical activity. Proper strength and function of the pectoralis minor muscle are important for maintaining good posture and shoulder mechanics, which can help prevent exercise-related injuries in the chest or shoulder region. Strengthening exercises targeted at the pectoralis minor muscle, along with the pectoralis major and other muscles of the chest and shoulder, can improve overall upper body stability and reduce the risk of injuries during exercise. Now, importance of the clavipectoral fascia in the union between the breast and clavicular and pectoral muscles. Okay, the clavipectoral fascia, here you can see the clavipectoral fascia, is a dense layer of connective tissue located deep within the chest wall, extending from the clavicle, collarbone to the axilla, and pectoralis major muscle. It serves as a strong fibrous shed to provide structural support and stability to the structures within the anterior chest wall, including the mammary gland. The clavipectoral fascia surrounds and encapsulates the mammary gland, helping to anchor it to the underlying muscles and bones of the chest wall. This fascia helps maintain the position and shape of the mammary gland, particularly during movements of the arms and upper body by providing a stable base of support. Okay, the connection with the clavicular and pectoral muscles and its role in a mammary anatomy. The clavipectoral fascia forms a connection between the clavicle pectoralis major muscle and other muscles and structure in the chest wall. It blends with the deep fascia of the pectoralis major muscle, providing a continuous shed that surrounds the mammary gland and helps integrate it with the surrounding musculature. Additionally, the clavipectoral fascia extends inferiorly into the axilla, where it contributes to the formation of the axillar fascia and supports the structures of the axillary region, including lymph nodes and blood vessels. The clavipectoral fascia plays a crucial role in a mammary anatomy by providing a stable and supportive framework for the mammary gland, ensuring its proper position and function within the chest wall. It also serves a pathway for blood vessels, nerves, and lymphatic vessels that supply and drain the mammary gland, facilitating the communication between the breast tissue and the rest of the body. Okay, now introduction to the blood supply of the mammary gland. The mammary gland is primarily supplied by branches of the internal thoracic artery and lateral thoracic artery. These arteries deliver oxygen and nutrients necessary for glandular function, particularly during lactation. They also facilitate the removal of waste products, ensuring the health and proper functioning of the mammary gland. Okay, here you can identify some structures. For example, in bones, clavicle, the subclavian artery, right vertebral artery, manubrium, pectoralis major, deeper, pectoralis minor, the internal thoracic artery, and its perforating branches. The medial mammary branches also, lateral mammary branches of lateral cutaneous branches of the posterior intercostal arteries, the lateral thoracic artery, brachial artery, axillary artery, and here the thoracoacromial trunk. Okay, now internal mammary arteries, origin and route. The internal mammary arteries are paired vessels that originate from the subclavian arteries. Okay, specifically the internal mammary arteries arise from the medial aspect of the subclavian arteries just below the level of the clavicle. Path of the internal mammary arteries and their distribution in the mammary gland. After originating from the subclavian arteries, the internal mammary arteries descend vertically along the inner surface of the chest wall. As they descend, they give off perforating branches that penetrate the intercostal muscles and reach the mammary gland. Once within the breast tissue, the internal mammary arteries branch further, forming an intricate network of smaller vessels that supply blood to different regions of the mammary gland. These arteries provide crucial oxygen and nutrients to the glandular tissue of the mammary gland, supporting its metabolic needs and facilitating proper glandular function, including milk production during lactation. Lateral mammary arteries function and distribution. The lateral mammary arteries are branches of the axillary artery, which is a major blood vessel located in the armpit. These arteries arise from the lateral aspect of the axillary artery, typically at a level below the shoulder joint. Importance of the lateral arteries in the blood supply of the mammary gland. The lateral mammary arteries contribute to the blood supply of the lateral portion of the mammary gland. They provide oxygen and nutrients to the breast tissue, supporting its metabolic needs and ensuring proper glandular function. While the internal mammary arteries are the primary source of blood supply to the mammary gland, the lateral mammary arteries supplement this supply, particularly to the lateral aspect of the breast. The lateral arteries play an important role in maintaining the overall health and function of the mammary gland, ensuring adequate blood flow to all regions of the breast tissue. The innervation of the mammary gland, motor and sensory nerves, or sensory or autonomic. It's the same as motor. Motor nerves. The motor innervation of the mammary gland is provided by branches of the autonomic nervous system, specifically the sympathetic and parasympathetic nerves. These nerves regulate smooth muscle contraction within the breast tissue, facilitating the ejection of milk during breastfeeding. Sensory nerves. The sensory innervation of the mammary gland is primarily supplied by branches of the intercostal nerves and the anterior cutaneous branches of the thoracic nerves. These nerves transmit sensory information from the breast tissue to the central nervous system, allowing for the perception of touch, pressure, temperature, and pain. Importance of innervation in glandular function and breast sensitivity. Motor innervation. The motor nerves plays a crucial role in milk ejection during breastfeeding. Sympathetic stimulation causes contraction of myoepithelial cells surrounding the alveoli, leading to the expulsion of milk into the ducts. The parasympathetic stimulation, on the other hand, facilitates milk production by stimulating glandular cells within the alveoli. Now, sensory innervation. The sensory nerves provide feedback to the central nervous system regarding the status of the breast tissue. This sensory input is essential for breastfeeding, as it helps initiate and regulate the suckling reflex and allows the mother to perceive sensations such as pain or discomfort. Indicating issues such as engorgement or infection. Additionally, sensory innervation contributes to breast sensitivity, enhancing sexual arousal and pleasure during intimate activities. Nervus plexus of the breast, organization and ramifications. Details about the organization of the nervus plexus of the breast and its ramifications of the mammary gland. The nervus plexus of the breast consists of a complex network of nerve fibers that innervate the mammary gland. This plexus is formed by branches of the intercostal nerves, the anterior and lateral cutaneous branches of the thoracic nerves, as well as sympathetic and parasympathetic fibers. The nerve fibers from these sources converge to form a network that extends throughout the breast tissue, with branches penetrating into the glandular tissue, blood vessels, and ductal system of the mammary gland. The nervous plexus of the breast plays a crucial role in regulating glandular contraction and milk ejection during breastfeeding. Sympathetic nerves stimulate the contraction of the myoepithelial cells surrounding the alveoli, leading to the expulsion of milk into the ducts, while parasympathetic nerves facilitate milk production by stimulating glandular cells within the alveoli. Additionally, sensory nerves within the nervous plexus provide feedback to the central nervous system regarding the status of the breast tissue, including sensation of touch, pressure, temperature, pain, all this. This sensory input helps regulate breast sensitivity and is essential for initiating and coordinating the suckling reflex during feeding. Clinical importance of breast innervation in lactation and sensitivity. The breast innervation plays a pivotal role in lactation and sensitivity. Sensory nerves detect suckling, prompting milk ejection through oxytocin release. Sympathetic and parasympathetic nerves regulate milk production, and the ejection sensory feedback coordinates breastfeeding. Any disruption can lead to lactation challenge and reduced breast sensitivity, impacting maternal-infant bonding and breastfeeding success. The venous drainage of the mammary gland. Mammary veins run alongside the arteries, collecting deoxygenated blood from the mammary gland's capillaries. They merge to form larger veins, ultimately connecting to the axillary or internal thoracic vein. Preserving mammary vein integrity is vital in breast surgeries to prevent complications like venous congestion or thrombosis, ensuring optimal tissue healing and minimizing postoperative risk, such as infection or impaired wound healing. Understanding their anatomy aids surgeons in minimizing this risk during procedures like breast reconstruction or mastectomy. Axillary and subclavian veins connection with the mammary venous system. The axillary vein is a major blood vessel located in the armpit, formed by the convergence of the basilic and the brachial veins. The subclavian vein is a large vein located beneath the clavicle collarbone, receiving blood from the axillary vein as well as other veins in the upper extremities. The mammary venous system drains the oxygenated blood from the mammary gland, with smaller mammary veins converging to form larger veins. These larger mammary veins ultimately connect to the axillary vein, which then drains into the subclavian vein. The axillary and subclavian veins play a crucial role in the venous drainage of the mammary gland, serving as a major conduit for deoxygenated blood to return to the heart. Proper venous drainage is essential for maintaining the health and function of the mammary gland, ensuring adequate removal of metabolic waste products and facilitating tissue perfusion. The connection of the mammary venous system with the axillary and subclavian veins ensures that blood from the breast tissue ultimately returns to the heart, where it can be oxygenated and circulated throughout the body. Any disruption or impairment in the venous drainage of the mammary gland, such as through obstruction or thrombosis of the axillary or subclavian veins, can lead to complications such as venous congestion, edema, or impaired tissue perfusion affecting breast health and function. Factors that can affect the blood supply and innervation of the breast. Injuries. Trauma to the chest or breast area can damage blood vessels and nerves, leading to impaired blood supply and innervation of the mammary gland. Surgeries. Breast surgeries such as mastectomy, breast reconstruction, or breast reduction can disrupt blood vessels and nerves, affecting the blood supply and innervation of the breast tissue. Medical conditions like breast cancer, fibrocystic changes, or infections can alter blood flow and nerve function in the breast, impacting its overall health and sensitivity. Pregnancy and lactation. During pregnancy and lactation, hormonal changes can increase Metabolic demands can affect blood flow and nerve sensitivity in the breast, influencing lactation and breast function. Age-related changes. With aging, there may be alterations in blood vessel structure and nerve function, leading to decreased blood supply and sensitivity in the breast tissue. Obesity. Excess adipose tissue in the breast can compress blood vessels and nerves, reducing blood flow and impairing nerve function. Radiation therapy. Radiation treatment for breast cancer can damage blood vessels and nerves in the breast, leading to long-term effects on blood supply and innervation. Systemic diseases. Conditions such as diabetes or cardiovascular disease can affect blood vessel health and nerve function, potentially impacting the blood supply and the innervation of the breast. Lifestyle factors. Factors such as smoking, poor nutrition, and lack of physical activity can contribute to vascular and neurological dysfunction, affecting the blood supply and the innervation of the breast tissue. Summary of the anatomical topography, blood supply, and the innervation of the mammary gland. The mammary gland is situated in the anterior chest wall, nestled between the skin and the pectoral muscles. It comprises lobules interconnected by ducts that converge towards the nipple. Blood supply to the mammary gland is predominantly from the internal mammary arteries and lateral thoracic arteries, while venous drainage occurs via the mammary veins, ultimately connecting to the axillary and internal thoracic veins. Innervation of the mammary gland involves both motor and sensory nerves, which regulate glandular function and transmit sensations like touch, pressure, and pain. This anatomical arrangement ensures the mammary gland's proximity to the circulatory and nervous system, vital for its proper function, lactation, and breast sensitivity. Now, introduction to the mammary lymphatic system. The mammary lymphatic system is a network of vessels and lymph nodes that play a crucial role in maintaining breast health. It serves to drain lymphatic fluid from the breast tissue, facilitating the removal of waste products, toxins, and cellular debris, and helping to regulate tissue fluid balance. Importance for breast health. The mammary lymphatic system is essential for breast health as it helps prevent the buildup of harmful substances within the breast tissue by efficiently draining lymphatic fluid. It aids in maintaining the proper function of the mammary gland and supports immune surveillance, protecting against infections and other pathological conditions. Additionally, the mammary lymphatic system serves as a pathway for the transportation of immune cells, such as lymphocytes, which play a critical role in immune defense and surveillance within the breast tissue. This contributes to the overall immune function and response of the breast, helping to defend against foreign invaders and maintain tissue homeostasis. Furthermore, the mammary lymphatic system is closely linked to the lymphatic drainage of other adjacent structures, such as the axillary lymph nodes, which are important in the staging and detection of breast cancer. Understanding the anatomy and function of the mammary lymphatic system is crucial for the diagnosis, treatment, and management of breast diseases, including breast cancer. Structure and function of mammary lymphatic vessels. Mammary lymphatic vessels are thin-walled tubular structures that form an extensive network within the breast tissue. They originate as blind-ended lymphatic capillaries, also known as lacteals, within the interstitial spaces of the breast lobules and ducts. These lymphatic capillaries converge to form larger collecting vessels that accompany blood vessels and nerve fibers throughout the breast tissue. The primary function of mammary lymphatic vessels is to collect excess tissue fluid, known as lymph, along with cellular debris, metabolic waste products, and immune cells from the breast tissue. Lymphatic vessels transport this lymph through a series of lymphatic nodes and trunks before eventually emptying into larger lymphatic ducts, such as the thoracic duct or the right lymphatic duct, which return lymph to the bloodstream. Mammary lymphatic vessels play a crucial role in immune response within the breast tissue. They transport immune cells, such as lymphocytes and macrophages, to lymph nodes, okay? Where they can encounter and respond to antigens, pathogens, or abnormal cells. Additionally, lymphatic vessels facilitate the removal of metabolic waste products, cellular debris, and toxins from the breast tissue. This waste elimination process helps maintain tissue health and function, preventing the buildup of harmful substances that could potentially contribute to the development of breast diseases. Furthermore, mammary lymphatic vessels contribute the circulation of antibodies and other immune factors, supporting immune surveillance and defense mechanisms within the breast tissue. Importance of the lymphatic system in breast health. Waste removal. The lymphatic system helps remove metabolic waste products, toxins, cellular debris, and and other harmful substances from the breast tissue by efficiently draining lymphatic fluid. It prevents the buildup of these substances, which could potentially contribute to the development of breast diseases. Immune function. The lymphatic system supports immune function within the breast tissue by transporting immune cells, such as lymphocytes and macrophages that we already talked, and to lymph nodes. These immune cells play a critical role in immune surveillance, detecting and eliminating abnormal cells, pathogens, and foreign invaders that could lead to breast diseases. Early detection of the breast cancer. The lymphatic system connection to the lymph nodes, particularly the axillary lymph nodes located in the armpit, is essential for the early detection of breast cancer. Changes in the size, texture, or consistency of the axillary lymph nodes may indicate the presence of cancer or other breast abnormalities, prompting further diagnostic evaluation. Metastasis prevention in breast cancer. Cancer cells can spread the nerve lymph nodes through the lymphatic vessels. The presence of cancer cells in lymph nodes indicates the potential for metastasis, spread of the cancer to other parts of the body. The lymphatic system's role in transporting lymphatic fluid and cancer cells to the lymph nodes is crucial for staging breast cancer and determining the appropriate treatment approach. Lymphatic drainage routes of the mammary gland. Axillary lymph nodes. The majority of lymphatic drainage from the breast occurs through the axillary lymph nodes, situated in the armpit region. Lymphatic vessels from various areas of the breast, including the upper, outer, and central regions, converge to form lymphatic trunks that drain into the axillary lymph nodes. These nodes are divided into levels, with level 1 being the most common site for breast lymphatic drainage. Internal mammary lymph nodes. Lymphatic vessels from the medial portion of the breast may also drain into the internal mammary lymph nodes. These nodes are located along the internal mammary artery and vein within the chest wall. They receive lymphatic drainage from the inner aspect of the breast and serve as a secondary pathway for lymphatic drainage. Interpectoral routers, interpectoral lymph nodes named router. Some lymphatic vessels from the central portion of the breast pass through the interpectoral space, Ruther's nodes, and drain into the contralateral lateral axillary lymph nodes or the supraclavicular lymph nodes. Supraclavicular lymph nodes, in rare instances, lymphatic drainage from the outer quadrant of the breast may directly reach the supraclavicular lymph nodes located above the clavicle. Axillary lymph nodes, location and function. The axillary lymph nodes, here, are a group of lymph nodes located in the armpit region adjacent to the axillary blood vessels. They play a crucial role in the lymphatic drainage of the mammary gland, receiving lymphatic fluid from various regions of the breast, including the upper, other, and central areas. We already talked about this. Lymphatic vessels from the regions converge to form lymphatic trunks that drain into the axillary lymph nodes, making them the primary site for lymphatic drainage from the breast. Okay, importance in detection and staging of breast cancer. The axillary lymph nodes are vital in detection and staging of breast cancer. Lymphatic drainage from the breast tissue to the axillary lymph nodes allows for the early detection of cancer cells that may have spread from the breast. The presence of cancer cells in the axillary lymph nodes indicates lymph node involvement, suggesting a more advanced stage of breast cancer and the potential for metastasis to the other parts of the body. Axillary lymph node status is a critical factor in determining the extent of disease and guiding treatment decisions in breast cancer patients. The number of involved axillary lymph nodes and the extent of lymph node involvement influence prognosis and treatment recommendations, such as the need for lymph node dissection or adjuvant therapies. Axillary levels of the lymph nodes implications in breast cancer. The level 1 here. Level 1 lymph nodes are located inferior to the lower border of the pectoralis minor muscle. This is the pectoralis minor. They primarily receive lymphatic drainage from the lateral aspect of the breast, including the upper outer quadrant. In breast cancer, the presence of cancer cells in level 1 axillary lymph nodes suggests early lymph node involvement and may indicate the need for further staging and treatment. The level 2, the mid-axillary, level 2 lymph nodes are situated deep to the pectoralis minor muscle and lateral to the lateral border of pectoralis major muscle. They receive lymphatic drainage from level 1 nodes as well as additional drainage from the central region of the breast. In breast cancer, the involvement of level 2 axillary lymph nodes indicates more extensive lymph node involvement and may influence treatment decisions, such as the extent of lymph node dissection and the need for adjuvant therapies. Level 3, high axilla. Here, the level 3 lymph nodes are located superior to the upper border of the pectoralis minor muscle. They receive lymphatic drainage from level 2 nodes and serve as gateway for lymphatic drainage from the central and the upper inner quadrant for the breast. In breast cancer, the presence of cancer cells in level 3 axillary lymph nodes signifies advanced lymph node involvement and suggests a higher risk of metastasis to distant sites. Supraclavicular lymph nodes role in the spread of breast cancer. Supraclavicular lymph nodes situated above the collarbone play a critical role in breast cancer progression by indicating advanced lymphatic spread. Particularly in case of metastasis, cancer cells from the breast can travel through lymphatic vessels to reach regional lymph nodes, including the axillary nodes, and may further spread to nerve nodes such as the internal mammary and supraclavicular nodes. The presence of cancer cells in supraclavicular lymph nodes signifies advanced disease and a higher risk of distant metastasis to organs like the lungs and liver. Detection of these cells influence treatment decisions, often necessitating more aggressive therapies, such as systemic chemotherapy or targeted treatments. Other lymph nodes relate to breast drainage. Internal mammary lymph nodes. The internal mammary lymph nodes are located along the internal mammary artery and vein within the chest wall, adjacent to the sternum. Lymphatic vessels from the medial portion of the breast drain into the internal mammary lymph nodes, providing an alternative pathway for lymphatic drainage. These nodes play a significant role in the spread of breast cancer, particularly in cases of central or medial breast tumors. In breast cancer staging, the involvement of internal mammary lymph nodes indicates a more advanced stage of disease and may influence treatment decisions. Second, the interpectoral routers lymph nodes. Here you can see the interpectoral routers is the most common name. Interpectoral lymph nodes, also known as routers nodes or level 2 nodes, are located between the pectoralis major and pectoralis minor muscles. Lymphatic vessels from the central portion of the breast may pass through these nodes and drain into the contralateral axillary lymph nodes or supraclavicular lymph nodes. In cases of breast cancer, involvement of interpectoral lymph nodes may indicate a higher risk of disease spread and influence treatment planning. The parasternal lymph nodes. Here. Parasternal lymph nodes are located along the internal mammary vessels and the sternum on either side of the chest. Lymphatic vessels from the medial aspect of the breast may drain into these nodes, particularly in cases of central breast tumors. The involvement of parasternal lymph nodes in breast cancer metastasis indicates advanced disease spread and may impact prognosis and treatment decisions. The lymphatic metastasis in breast cancer, route of spread and prognosis. In breast cancer, lymphatic metastasis involves the spread of cancer cells from the primary tumor in the breast to regional lymph nodes through the lymphatic vessels. This process follows a predictable route, with cancer cells infiltrating lymphatic vessels surrounding the tumor and eventually reaching regional lymph nodes such as the axillary, internal mammary, or supraclavicular nodes. Lymphatic metastasis indicates disease progression and is associated with a poorer prognosis. The extent of lymph node involvement, including the number of affected nodes and the presence of extranodal extension, influences disease staging and treatment decisions. Metastasis to specific lymph node groups, such as the internal mammary or supraclavicular nodes, signifies advanced disease and poorer outcomes. Response to treatment and the persistence of lymphatic metastasis despite therapy are also prognostic indicators. Importance of early detection and treatment of breast cancer. Early detection and timely treatment of breast cancer are critical for improving patient outcomes. Detecting breast cancer at an early stage offers patients a wider range of treatment options, including less aggressive therapies with better outcomes and fewer side effects. Early treatment significantly improves survival rates, reduces disease-related complications, and preserves breast functionally and in appearance. Moreover, early intervention is cost-effective and reduces healthcare expenditures associated with managing advanced stage disease. Implementing effective screening programs and raising awareness about breast health are essential for promoting early detection and optimizing patient outcomes in breast cancer. Anatomy and function of the interpectoral lymph nodes. Interpectoral lymph nodes, also known as router nodes or level 2 lymph nodes, are situated between the pectoralis major and pectoralis minor muscles in the axilla. These nodes receive lymphatic drainage from the central portion of the breast, including the area around the nipple and areola. Interpectoral lymph nodes serve as intermediate collectors of lymphatic fluid before it reaches the more centrally located axillary lymph nodes. Role in lymphatic drainage. Lymphatic vessels from the central region of the breast pass through the interpectoral space and converge at the interpectoral lymph nodes. From there, lymphatic fluid is further transported to adjacent lymph node groups such as the axillary lymph nodes or supraclavicular lymph nodes for filtration and immune surveillance. Lymph nodes of the axillary apex location and function. The lymph nodes of the axillary apex or level 3 lymph nodes are positioned at the uppermost part of the axilla near its junction with the thoracic cavity. They serve as crucial collectors of lymphatic drainage from various regions of the breast, including the upper outer, central, and upper inner quadrants, as a convergence point for lymphatic vessels from all the axillary lymph node levels. They play a pivotal role in filtering lymphatic fluid, facilitating immune surveillance and potentially capturing metastatic cancer cells. Understanding their function is essential in breast cancer diagnosis, staging, and treatment planning. Internal mammary lymph nodes implications in breast disease. Here, internal mammary. The internal mammary lymph nodes are located along the internal mammary vessels within the chest wall are crucial for the lymphatic drainage for the mammary gland. They serve as an alternative pathway for lymphatic fluid alongside the axillary lymph nodes. Metastasis to these nodes in breast cancer indicates advanced disease and influence treatment decisions. Okay. Importance of clinical evaluation of mammary lymph nodes. Detection and staging of breast cancer rely on palpation and assessment of mammary lymph nodes, where enlarged or palpable nodes may indicate lymphatic spread and a more advanced disease stage. Identifying lymph node involvement is crucial for accurate staging, guiding treatment decisions, and predicting patient prognosis. The status of mammary lymph nodes significantly influences treatment planning, with metastatic disease often prompting more aggressive treatments, like lymph node dissection. Radiation therapy involvement may allow for less aggressive treatment approaches, reducing treatment-related complications. Lymph node involvement also holds prognostic significance, as patients with metastasis typically face a higher risk of disease recurrence and poorer survival rates. Accurate evaluation of mammary lymph nodes aids in predicting patient outcomes and tailoring personalized treatment strategies for breast cancer. Evaluation methods and their clinical relevance. In breast cancer, screening and evaluation physical examination involves palpation of the axillary, supraclavicular, and internal mammary lymph nodes to detect any enlargement or palpable abnormalities. Enlarged nodes may prompt further diagnostic evaluation. Imaging modalities like ultrasound, mammography, and MRI are utilized to assess the size, shape, and morphology of mammary lymph nodes. Abnormal findings, such as enlargement or irregularity, may indicate metastatic involvement, guiding further diagnostic workup. Biopsy, including fine needle aspiration, FNA, or core needle biopsy. Here, the first example, core needle biopsy, is performed on suspicious lymph nodes to obtain tissue samples for histopathological examination. Biopsy results confirm the presence of metastatic disease in lymph nodes, providing valuable information for disease staging and treatment planning. Here you can see the examples. The FNA, collecting sample of cells. Core needle biopsy collects part of tissue, ultrasound or MRI, and surgical biopsy removes all or part of the abnormality. Sentinel node biopsy, technique and relevance in breast cancer. Sentinel node biopsy is a minimally invasive surgical technique used in breast cancer management to identify the sentinel lymph node, the first nodes to receive drainage from the tumor by injecting a tracer substance Surgeons locate and assess these nodes during surgery, providing crucial information about lymph node involvement. SMB guides personalized treatment approaches by informing cancer staging and treatment planning. It reduces the need for extensive lymph node surgery, improving patient outcomes by minimizing surgical morbidity while optimizing treatment strategies. Breast lymphatic drainage in men. Differences and similarities with drainage in women. Similarities: both men and women have a network of lymphatic vessels that drain lymph fluid from the breast tissue to regional lymph nodes in both genders. Lymphatic drainage pathways include axillary, internal, and intercostal lymph nodes. Differences: women typically have a more extensive lymphatic network and a higher density of lymphatic vessels in the breast tissue due to the functional demands of lactation. Additionally, women have a greater likelihood of lymph node involvement in breast cancer due to the higher incidence of the disease. Breast size and lymphatic density. Women generally have larger breasts and a denser network of lymphatic vessels compared to men. This anatomical difference may affect the spread of breast cancer in women with a higher likelihood of lymphatic involvement. Hormonal influence, hormonal fluctuations during the menstrual cycle, and hormonal changes during pregnancy and breastfeeding can impact breast lymphatic drainage patterns in women. These hormonal factors may contribute to differences in lymphatic function and susceptibility to breast diseases between men and women. Clinical implications. Understanding the anatomical and physiological differences in breast lymphatic drainage between men and women is crucial for accurate diagnosis and treatment of breast diseases, including breast cancer. Differences in lymphatic drainage patterns may influence the staging and management of breast cancer in men versus women, highlighting the importance of tailored approaches to diagnosis and treatment based on gender-specific anatomy and physiology. Factors that can affect the lymphatic drainage of the mammary gland. Surgery, radiotherapy, and lymphatic disease can all disrupt the lymphatic drainage of the mammary gland, affecting breast health and breast cancer treatment outcomes. Surgical procedures like lumpectomy or mastectomy may damage or remove lymphatic vessels, potentially leading to lymphedema, a condition characterized by tissue swelling. Similarly, radiation therapy can further impair lymphatic drainage, increasing the risk of lymphedema. Additionally, conditions like lymphedema or lymphatic malformations can directly impact drainage, causing fluid buildup and discomfort in the breast tissue. Managing these factors involves proper monitoring, rehabilitation, and conservative measures to alleviate symptoms and improve patient quality of life. Clinical management of mammary lymphedema. Mammary lymphedema to the accumulation of lymphatic fluid in the breast tissue resulting in swelling, discomfort, and other symptoms. This condition typically occurs as a result of impaired lymphatic drainage, often following surgery or radiation therapy for breast cancer. The symptoms of mammary lymphedema may include breast swelling and enlargement, heaviness or thickness in the breast, skin changes such as redness or thickening, pain or discomfort in the breast area, limited range of motion in the arm or shoulder on the affected side. Compression therapy using compression garments or bandages promote lymphatic fluid drainage and prevent fluid buildup in the breast tissue. The manual lymphatic drainage, a specialized massage technique to stimulate lymphatic flow, reduce swelling, and improve circulation. Exercise and movement, engaging in regular physical activity and specific exercise to improve lymphatic circulation and reduce fluid buildup in the breast tissue. Skincare, proper skincare to prevent complications such as infections by keeping the skin clean, moisturized, and protected from injury. Lifestyle modifications, making lifestyle changes such as maintaining a healthy weight, avoiding constructive clothing, practicing good posture to manage symptoms and improve overall lymphatic health. Surgical interventions, in severe cases that do not respond to conservative treatments, surgical options like lymphaticovenous anastomosis or LVA or vascularized lymph node transfer may be considered to restore lymphatic drainage and reduce swelling. Okay, prevention and treatment strategies for lymphedema. Providing information about risk factors and early signs. Risk reduction, avoiding injury and infection, maintaining a healthy weight and protecting the affected area. Compression therapy, using garments or bandage to reduce swelling. Okay, we already see this. Summary of the anatomy of the mammary lymphatic system and its relationship with the mammary gland. The mammary lymphatic system consists of a network of lymphatic vessels and lymph nodes that play a crucial role in maintaining breast health. Lymphatic vessels originate within the breast tissue and drain lymphatic fluid from the mammary gland, the regional lymph nodes, including the axillary, internal mammary, and supraclavicular nodes. These lymph nodes act as filtering stations, removing toxin, waste products, potentially harmful substances from the lymphatic fluid before it returns to the bloodstream. The lymphatic system also facilitates immune surveillance and response, helping to defend against infection and diseases. The close relationship between the mammary lymphatic system and the mammary gland underscores its importance in breast health. Proper lymphatic drainage is essential for maintaining tissue fluid balance, removing metabolic waste products, and supporting immune function within the breast tissue. Dysfunction or impairment of the mammary lymphatic system can lead to complications such as lymphedema, a condition characterized by fluid buildup and swelling in breast tissue. Therefore, understanding the anatomy and function of the mammary lymphatic system is crucial for the prevention, diagnosis, and treatment. Conclusions about the anatomical topography and lymphatic system of the mammary gland. Topographic anatomy. The mammary gland is located in the chest region with lobules and ducts responsible for milk production and secretion. It is enveloped by superficial and deep fascia, intimately connected to the pectoral muscles and supported by Cooper's ligaments. The gland's proximity to major blood vessels and lymphatic structures underscores its integration into the circulatory and immune system. Lymphatic system. The mammary gland is extensively drained by lymphatic vessels that converge towards regional lymph nodes, including axillary, internal mammary, and supraclavicular nodes. These nodes play a crucial role in filtering lymphatic fluid, removing toxins, facilitating immune responses. Dysfunction in the mammary lymphatic system can lead to conditions like lymphedema and may impact the breast health and disease outcomes. The importance of understanding anatomy for clinical practice and breast surgery. Surgical planning. Surgeons rely on knowledge of breast anatomy to plan and perform procedures accurately, minimizing risks and optimizing outcomes. Diagnostic accuracy. Clinicians need to interpret imaging studies and guide biopsy procedures accurately by recognizing normal anatomy and variations. Minimizing complications. Precise anatomical knowledge helps surgeons avoid inadvertent injuries during surgery, reducing the risk of complications. The patient education. Understanding breast anatomy enables effective communication with patients, fostering informed decision-making and engagement in their care. Postoperative care. Clinicians use anatomical understanding to monitor patients for complications and provide appropriate postoperative management. Recommendations for the early detection of breast cancer. Breast self-examination, encouraging women to perform regular BSA, allows for the detection of any changes in breast tissue, such as lumps or abnormalities, which may warrant further investigation. Regular mammography, women aged 40 and older are advised to undergo regular mammograms as part of breast cancer screening programs. Mammography can detect breast cancer at an early stage, often before symptoms are noticeable, improving treatment outcomes. Clinical breast examination, healthcare providers should perform as part of routine health checkups to assess for any signs or symptoms of breast cancer. Summary about mammary glands. The location. The mammary glands are located in the anterior part of the chest, on both sides of the midline. Okay, just above the pectoral muscles and extending from the second to the sixth, seventh rib. General structure. Each mammary gland is composed of multiple lobes, which in turn contain several lobules. These lobules are small glandular structures that produce milk during lactation. The lobules are connected by ducts that carry milk to the nipple. Adipose tissue surrounds and supports the lobes and glandular ducts. The amount of adipose tissue varies depending on age, hormonal status, and other factors. The nipple is a small lump in the center of the breast that contains numerous lactiferous ducts. During lactation, milk is expelled through these ducts. Areola is the area. Areola is the area of pigmented skin that surrounds the nipple. It contains sebaceous glands that produce lubrication to protect the skin during lactation. Vascularization. The mammary glands are highly vascularized with a network of arteries and veins that provides nutrients and oxygen to the glandular tissues as well as a pathway. Innervation. They are innervated by nerves from the brachial plexus and intercostal nerves, which are responsible for the sensation in the breast and the ejection reflex of milk during lactation. Changes during breastfeeding. During pregnancy and lactation, the mammary glands undergo significant changes to produce and release milk for the baby. This process is influenced by hormones such as prolactin and oxytocin. In short, mammary glands are complex anatomical structures that play a crucial role in breastfeeding and nutrition of the baby, as well as in breast health in general. Its detailed anatomy is essential to understand its function and to diagnose and treat breast conditions. That's all for today. Thank you for your attention. Bye.